Hey guys, I'm Dr. Shah with the Colorado Ear, Nose, Throat Group. In this quick video, I'm going to talk to you about what is endoscopic sinus surgery, what are some of the benefits and why would you want to do it, what are some of the risks so you should understand, if you choose to do it, what are you signing up for, and what does the recovery sound like? So let's get into it. So first things first, what is endoscopic sinus surgery? Well, inside your nose, there are a bunch of things called sinuses. And these sinuses are here, 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 and even in the back of your head. What can happen is the drainage pathway that lets things come from the sinuses back into the nose, so from the sinus into the nose, can actually swell shut and close, and things can get stuck in the sinuses, leading to facial pain and pressure, constantly runny nose, drippy nose, irritation, and needing to take antibiotics all the time. This can be really frustrating for patients. So one of the things we can do is we can go back in as surgeons and we can actually open up the drainage pathways using tools in the operating room. What this does is it allows your nasal anatomy to return to normal so you can actually drain appropriately. This surgery typically takes about an hour, and the benefit again is that you're going to have normal nasal anatomy. So let's talk about the surgery. What are some of the risks and what does it mean? You go to an operating room, you go fully to sleep so you don't feel anything. We then use some devices and tools to help open up things in your sinuses so you can breathe better, sleep better, and hopefully feel better, and hopefully get less sinus infections. I always tell my patients, look, we're not putting you in a bubble, so it's not like you can't get a sinus infection, but when you get a sinus infection, if your anatomy functions normally, it's gonna last the way most other people's last. Whereas if we're recommending you for sinus surgery, you're probably someone that's getting sinus infections all the time, or they're lasting for weeks and weeks when you get them. If we can get your anatomy back to normal anatomy, we can make it so that you can hopefully heal from a sinus infection faster. So those are the big benefits: breathing better, sleeping better, less antibiotics, less infections, and just less misery. But what are some of the risks? Well, whenever you have surgery, there's three main risks: risk of bleeding, risk of infection, and risk of damage to surrounding structures, and then other risks that it doesn't work. So let's talk about each one of those risks. Anytime we make an incision inside the nose can bleed like stink. So there's always a chance that for a few days after surgery you drip blood, and sometimes patients can have a really bad nosebleed. That's not common, but if it happens, you might have to go to the emergency room, and they might even have to put some packing in there to hold pressure and stop it. Thankfully, this does not happen commonly, but it's possible. The second risk is you can get an infection, right? But generally if we're doing this surgery, it's because you probably already have infections, and so we're just trying to help open them up. If you get an infection, sometimes you'll have to speak with us, and we might have to put you on antibiotics, but generally we do not do that. And the third risk is damage to surrounding structures. So what are the important structures next to your sinuses? Well, right above your sinuses is your brain, and above this cheek sinus is your eye. This is why we will oftentimes use navigation during the surgery. So we'll take that CAT scan that you had, we'll sync it to our instruments, and that way when we're in surgery, if we put the instrument here on the screen, we'll see that we're right there. And so this is one of the ways that we make sure we keep you safe. And the good news is all of us have to go through 10 years of training to be able to do the surgery, and so we know we can take care of you safely. I would say, honestly, the biggest risk after this type of surgery is that it doesn't work. For endoscopic sinus surgery, approximately 90% of patients will do well, but 5 to 10% of patients may need further surgery or further antibiotics. This is because human beings are complicated, and we just can't guarantee anything with medicine. But what I can promise is our team will do our absolute best to try and make you feel better, and there's always a risk that if something doesn't work, what we promise is that we will do our best to try to keep working with you to get you feeling better. Now, what does it look like to recover after this surgery? So after you have the surgery, you're probably gonna have a couple days of really stuffy nose, you might have a drippy nose, you might have a little bit of bleeding, and you might even have some pain. The majority of patients are gonna use Tylenol and Motrin, but some patients might need to use opioid pain meds, and some patients might even need to use antibiotics. It's not common, but this is possible. We tell patients you're gonna take about 2 weeks off from any heavy lifting or serious exercise just to make sure that you don't have a nosebleed, and also that you can just have your body focus on healing. And then here's the most interesting thing. After endoscopic sinus surgery, we make the hole between your nose and your sinus bigger, but your body sees a hole and it's gonna try to make it smaller. So we actually bring you back to the office about 2 or 3 times, and we'll use an endoscope and we'll look in there and we'll just make sure if there's any scabs or anything trying to close the hole off that we fix that. That's called a debridement. So you'll see us about 2 to 3 times to make sure you're healing well. Those are not painful, and generally patients do really well, but we just want you to know that that's a possibility after surgery. After you've debrided and you've started to heal, most patients are going to start to feel like they can breathe better, they'll sleep better, most patients will have less sinus infections, and overall patients feel like they get a lot of benefit out of the surgery. This is one of our favorite surgeries to do for patients, and it's one of the most common things that ENTs do for patients because sinus infections are so frustrating, and we want to make sure patients feel better. Hopefully this video gives you some answers to common questions you might have about this surgery, and if you have more questions, feel free to reach out. Thanks.